all think we'd survive a zombie apocalypse just because we've watched a few movies. Spoiler alert, you wouldn't. You'd trip over your own shoelaces and die of an infection because you put butter on a cut. Humans are fragile bags of water, and your common sense is usually just a collection of old wives' tales that kill people. Let's see how many ways you were planning to accidentally delete yourself today.
He's right. We grew up thinking whiskey cures a cold, raw steak fixes a black eye, and CPR is just a magical kiss that wakes up the dead. But biology doesn't care about your nostalgia. In the real world, these myths don't save lives, they end them. Today, we are dismantling 30 first aid myths that are actually death sentences. This isn't just a list, it's a survival guide for the modern man. Myth 1. Butter on a burn. Let's start with a kitchen classic that needs to be buried in the backyard. You touch a hot cast iron skillet, sear your fingerprint off, and your instinct is to grab a stick of butter or a tub of margarine from the fridge. Stop. You are not a Thanksgiving turkey, and you do not need to be basted. The reality: grease and oil are excellent heat insulators. That is literally why we use them to fry chicken. They hold heat. When you smear butter on a burn, you are effectively sealing the heat inside your skin. You create a thermal greenhouse effect, preventing the heat from escaping into the air. Instead, that heat burrows deeper into your tissue, cooking you from the inside out like a slow-roasted brisket. You turn a first-degree burn into a second-degree burn just by adding a condiment. Furthermore, butter is food. Food rots. By applying it to broken skin, you are frosting an open wound with a layer of bacteria. The only thing you should put on a burn is cool running water for 20 minutes to dissipate the thermal energy. Save the butter for the corn. Myth 2. Hydrogen peroxide on wounds. We all have that childhood memory, the scraped knee, the brown bottle, and the satisfying white foam. We were told the bubbles meant it's working and cleaning out the dirt. We were lied to. That fizzing sound isn't the death of bacteria, it's the scream of your own healthy cells dying. The reality: hydrogen peroxide is a biological nuke. It creates a chemical reaction that releases oxygen, which tears apart cell walls. It kills germs, sure, but it is non-discriminating. It also destroys fibroblasts, the specific cells your body needs to rebuild skin and close the wound. By using peroxide or rubbing alcohol daily, you are chemically burning the fresh edges of the cut, ensuring it heals slower and leaves a nasty, jagged scar. Doctors haven't recommended this for years. It's great for getting bloodstains out of your driveway, but keep it off your body. Use soap and warm water. It's boring, it doesn't bubble, but it actually works without nuking your immune system. Myth 3. Tilting head back for a nosebleed. This is the most common reflex in America. You see blood, you look at the ceiling. It feels logical. Gravity stops the flow, right? Wrong. When you tilt your head back, the bleeding doesn't stop. You are just turning your throat into a drain pipe. The reality: that blood runs down your esophagus and into your stomach. Blood is a powerful emetic, which is a fancy medical way of saying it irritates the stomach lining and makes you vomit violently. Now you have a nosebleed and you are puking acid and blood. Even worse, if the blood flows into your airway, you can develop aspiration pneumonia. You are literally drowning in your own fluids. The correct method is to lean forward, like you're looking at your shoes, and pinch the soft part of your nose below the bridge. Let it drip out. Don't turn your stomach into a vampire's smoothie blender. Myth 4. Inducing vomiting, Ipecac. For decades, every medicine cabinet in the U.S. had a bottle of syrup of Ipecac. If a kid swallowed drain cleaner or pills, parents were told to make them throw it up immediately. We know better now. Ipecac is dead, and for good reason. The reality: if you swallow a corrosive chemical like bleach, gasoline, or lye, it burns your esophagus on the way down. If you force yourself to vomit, you are forcing that acid to travel back up the same pipe. You are double dipping on chemical burns, turning your throat into hamburger meat. This can cause the esophagus to rupture, which is often fatal. Furthermore, if the poison is foamy or petroleum-based, vomiting increases the risk of inhaling the foam into the lungs, causing immediate chemical pneumonia and suffocation. Throw away the ipecac. Call poison control. Do not try to reverse the flow of traffic on a highway made of acid. Myth 5. Sweating out a fever. You feel the chills, your teeth are chattering, so you decide to pile on 3 wool blankets, crank up the thermostat, and sweat out the sickness. You think you're helping your immune system fight the war. You're actually cooking your brain. The reality. A fever is your body's tactical response to cook a virus. It raises the thermostat to make the body inhospitable to germs. But if you insulate yourself like a Chipotle burrito, you trap that metabolic heat. You can inadvertently drive your core temperature up to 105 or 106 degrees. At that point, you aren't fighting the flu, you are denaturing your own proteins. This leads to heat stroke, seizures, and hallucinations. If you have a high fever, you need to cool down, not heat up. Wear light clothing, keep the room cool, and take Tylenol. You are a human being, not a sauna. Stop trying to sous vide yourself back to health. Myth 6. Raw steak on a black eye. We have all seen it in Looney Tunes, the Three Stooges, or old boxing movies. The hero gets punched, and he slaps a giant raw T-bone steak on his face. In reality, this is a fantastic way to lose an eyeball. The reality. Raw meat is teeming with bacteria like E. coli, Salmonella, and Listeria. When you have a black eye, you likely have microabrasions or tiny cuts around the eyelid. Putting raw meat on it is literally injecting fecal bacteria directly into your eye socket. You will trade a simple cosmetic bruise for a blinding orbital cellulitis infection that could travel to your brain. The only reason meat worked in the 1920s is because it was cold. You know what else is cold? A bag of frozen peas or crushed ice in a towel. And the peas won't give you a parasitic worm infection.
Look at you. You survived childhood despite your best efforts to marinate your burns and infect your eyes with raw beef. But don't get cocky. We haven't even touched the engine room yet. Your heart and brain are fragile little biomachines, and you treat them like rental cars. Let's see how you handle the big stuff, the stuff that kills you in minutes.
Myth 7. Cough CPR. Every few years, a viral post circulates on Facebook or WhatsApp, claiming that if you feel a heart attack coming on, you should cough rhythmically and vigorously to squeeze the heart and keep blood flowing. This is absolute internet garbage. The reality. Cough CPR exists, but it is used only in a catheterization lab with a cardiologist watching a monitor for very specific rhythm issues in conscious patients. It requires precise timing. For a regular guy having a heart attack in his kitchen, coughing does nothing but waste precious oxygen, spike your blood pressure, and increase the workload on a heart that is already dying. You cannot cough your way out of a blocked artery. If you feel the elephant sitting on your chest, sit down, chew an aspirin to thin the blood, and call 911. Do not die hacking up a lung because you trusted a meme from 2009. Myth 8. Heart attacks look like the movies. Gentlemen, listen up, because this myth kills your wives and mothers. In Hollywood, a heart attack is always a man clutching his left arm, grimacing and collapsing in dramatic agony. Because of this, we think that's what every heart attack looks like. The reality. Women often experience heart attacks completely differently. They might feel nausea, extreme fatigue, jaw pain, back pain, or just a generic sense of doom. Because it doesn't look like the movie scene, they take a nap instead of calling an ambulance, and they never wake up. Even for men, silent heart attacks happen without the chest clutch. If you feel like you just ran a marathon, but you're sitting on the couch, your ticker is in trouble. Ignore Hollywood. Trust your body. If something feels wrong, it probably is. Myth 9. Pricking fingers for a stroke. There is a dangerous chain email that refuses to die. It claims you can save a stroke victim by pricking their fingertips with a sewing needle to release pressure, and let a few drops of blood out. This is medieval sorcery, not medicine. The reality. A stroke is usually a clot blocking blood flow to the brain, ischemic, or a bleed inside the skull, hemorrhagic. Pricking a finger does absolutely zero for intracranial pressure. It's like trying to fix a flat tire by opening the glove box. All you are doing is causing pain, spiking the victim's blood pressure, and delaying real treatment. Time is brain. You have a roughly 3-hour window to get clot-busting drugs. If you waste 20 minutes playing voodoo acupuncturist, you are guaranteeing permanent brain damage or death. Do the FAST test: face, arms, speech, time, and drive. Myth 10. Back blows when coughing. You are at a steakhouse. Your buddy starts coughing on a piece of ribeye. Your instinct is to whack him on the back like you're burping a giant hairy baby. Stop. If he is coughing, do not touch him. The reality. Coughing means air is still moving. It means the obstruction is partial. If you smack him on the back while he is upright, gravity and the force of your hit can dislodge the food and drop it deeper into the trachea, turning a partial blockage into a total seal. Now he is silent, turning blue, and actually dying. Only hit him if he stops making noise entirely. Then lean him forward so gravity helps you, not the food, and deliver distinct blows. If he can cough, let him fight the battle himself. Myth 11. Defibrillators restart a flatline. Every medical drama ends with the monitor going beep, flatline, and the doctor yelling clear and shocking the patient back to life. This is a complete lie. A defibrillator does not jumpstart a dead heart like a car battery. The reality. It actually stops the heart. It's used for ventricular fibrillation when the heart is quivering uselessly like a bag of worms. The shock stops the electrical chaos, hoping the heart's natural pacemaker reboots in a normal rhythm. If you have a flatline, a systole, there is no electrical activity to reset. The battery is dead. Shocking a flatline just burns the meat. The only cure for a flatline is high-quality CPR and epinephrine. If the line is flat, keep pumping. The electric paddles are useless toys here. Myth 12. Mouth-to-mouth is mandatory. Many people are afraid to do CPR because they don't want to lock lips with a stranger who might be vomiting or bleeding. Good news, you don't have to. The American Heart Association changed the guidelines years ago. The reality, for the average bystander, hands-only CPR is the standard. When the heart stops, the blood still has enough oxygen in it to keep the brain alive for a few minutes. The problem is, the pump is broken. Your job is to be the pump. Interrupting compressions to fumble with the airway and blow air wastes precious blood pressure. Just push hard and fast in the center of the chest to the beat of "Stayin' Alive" by the Bee Gees. Don't worry about the breath. Just keep the blood moving to the brain.
You're sweating. Good. You realize now that your common sense is just a collection of bad movie scripts. Fear is useful. Fear keeps you alert. Now let's go into the garage in the woods where nature is actively trying to murder you, and your survival skills are going to get you eaten.
Myth 13. Tourniquets mean amputation. This is a myth left over from the trenches of World War I. People believe that if you put on a tourniquet, the limb will die from lack of blood flow and have to be cut off. Because of this fear, people use weak pressure dressings while the victim bleeds to death in the passenger seat of a Prius. The reality. Modern data from the battlefields of Iraq and Afghanistan proved this wrong. A commercial tourniquet can stay on for 2 hours, sometimes up to 6, with zero long-term damage to the limb. But you know what causes permanent damage? Being dead. Exsanguination, bleeding out, from a femoral artery can kill a man in 3 minutes. If bright red blood is spurting, crank that strap down until it hurts. Pain means life. Do not hesitate. You are saving a life, not losing a leg. Myth 14. Pulling out the knife. You've been stabbed, or you fell on a piece of rebar at a construction site. It looks grotesque, and your instinct is to get that thing out of me. Do not touch it. That object is currently the only thing keeping you alive. The reality. The blade has severed blood vessels, but it is also plugging them. It is acting like a cork in a wine bottle. The muscles contract around the object, creating a partial seal. The moment you pull it out, you uncork the dam. Internal pressure drops, and you will bleed out in minutes, long before the ambulance arrives. Leave it in. Pack gauze around it to stabilize it so it doesn't wiggle and slice more insides. You are a package now. Let the surgeon unwrap you in the operating room. Myth 15. Moving a crash victim. You see a car accident. The driver is slumped over. You run up, open the door, and drag them out to safety on the side of the road. Unless that car is literally on fire or about to fall off a cliff, you might have just paralyzed them for life. The reality. In a high-speed crash, the neck acts like a whip. The cervical spine may be fractured but still aligned. When you yank them out like a rag doll, you shift the broken vertebrae, slicing the spinal cord like a guillotine. Now they are a quadriplegic because you wanted to play hero. If they are breathing and the car isn't exploding, leave them alone. Hold their head still and wait for the pros with the neck brace and backboard. Myth 16. Setting a bone. We've all seen the action hero slam his dislocated shoulder against a wall to pop it back in, or snap a broken leg straight with a stoic grimace. If you try this, you are an idiot. The reality. Real bones aren't Lego pieces. Sharp bone shards are sitting next to major arteries and nerves. If you try to force a broken limb straight without x-rays, you can shear an artery, causing massive internal bleeding, or sever a nerve, causing permanent paralysis of that limb. Setting a bone requires muscle relaxants and anesthesia. Splint it as it lies. Do not try to be Mel Gibson. You'll just be a guy with a malpractice lawsuit and a crippled friend. Myth 17. Loosening the tourniquet. Some old survival manuals suggested loosening a tourniquet every 15 minutes to let blood to the limb. This is aggressively stupid and lethal. The reality. When a limb has no blood flow, toxins and potassium build up in the dead tissue. It becomes a toxic soup. If you loosen the tourniquet, you flush that toxic sludge straight into the heart. This causes reperfusion injury and immediate cardiac arrest. Once the tourniquet is on, it stays on until a doctor takes it off. Write the time you put it on the victim's forehead with a Sharpie, and don't touch it again. You are not a plumber. Stop adjusting the valves. Myth 18. Popping blisters. You've been hiking and you have a massive fluid-filled bubble on your heel. It hurts, so you grab a safety pin and pop it. Congratulations, you just removed the best biological dressing known to man. The reality. That fluid is sterile serum protecting the raw skin underneath. The bubble is a natural barrier against dirt and feces. When you pop it, you turn a sterile environment into an open portal for staph and strep bacteria. Walking in sweaty, dirty boots with an open sore is a recipe for sepsis. Pad it with moleskin, tape around it, but let your body do the work. Don't perform surgery in the woods with a dirty safety pin. Myth 19. Sucking the venom. You get bit by a rattlesnake. Your buddy pulls out a knife, cuts an X, and tries to suck the poison out. This is not just useless, it's dangerous for both of you. You are watching too many westerns. The reality. Venom doesn't sit in the wound like a puddle. It enters the bloodstream almost instantly. Sucking gets almost nothing out. However, the human mouth is a sewer of bacteria. You are spitting germs directly into a necrotizing wound. Plus, if the sucker has a gum bleed or a cavity, the venom enters their bloodstream too. Now there are 2 victims. Keep calm, keep the limb low, and get to a hospital. Leave the vampire roleplay at home. Myth 20. Tourniquet on a snakebite. We just told you tourniquets save lives for bleeding, but for snake bites, they are a disaster. Do not confuse the two. The reality. Pit viper venom destroys tissue. It is cytotoxic. If you trap that venom in the hand or foot with a tourniquet, It concentrates the destruction. It will liquefy the muscle and skin in that isolated area, guaranteeing that you will lose the hand to gangrene. It is better to let the venom dilute through the whole body. Modern antivenom can handle that. It cannot fix a hand that is rotted off in 30 minutes. Do not bind it. Immobilize it. Myth 21. Playing dead for bears. If you see a bear, play dead. If you do this with a black bear, you are just serving yourself up as a burrito. The reality. You have to know your bears. Grizzly, brown, bears attack to defend territory or cubs. Playing dead tells them you aren't a threat, so they might leave. But black bears, the most common in the US, are scavengers. If a black bear attacks, it wants to eat you. If you play dead, it will start chewing on your leg. The rhyme saves lives. If it's brown, lay down. If it's black, fight back. Punch it in the nose, gouge its eyes, make noise. Do not be a passive snack. Myth 22. Moss grows on the north. You're lost in the woods. You look for a tree with moss to find north. You walk that way and die of exposure 3 days later. The reality. Moss does not own a compass. Moss likes moisture and shade. In the northern hemisphere, the north side is often shadier, but moss can grow on the south side if there's a damp rock nearby, or all around the tree if it's a humid forest. It grows wherever it can survive. Navigating by moss is the hallmark of a corpse found by search and rescue teams. Learn to use the sun, the stars, or buy a $5 compass. Myth 23. Drinking cactus water. You are dehydrated in the desert. You see a cactus. You think, "Aha, a green water tank." You hack it open and drink the sap. The reality. Within an hour, you are vomiting violently and have explosive diarrhea. Most cactus sap is highly alkaline and toxic to humans. It's not water, it's a chemical cocktail. The vomiting will dehydrate you 10 times faster than if you had just stayed thirsty. The only safe cactus is the fishhook barrel cactus, and even that tastes like bitter battery acid. Stay away from the spiky plants. They hate you. Myth 24. Burning a tick. You find a tick dug into your skin. You grab a match or a lighter to burn it out, thinking the heat will make it let go. The reality. When you burn a tick or smother it with nail polish, it goes into shock. Before it dies, it regurgitates the contents of its stomach directly into your bloodstream. You are literally forcing it to vomit Lyme disease, Rocky Mountain spotted fever, and alpha-gal syndrome into your body. The only way to remove a tick is mechanical. Fine-tipped tweezers, grab the head, pull straight up. Don't torture it, just evict it. Myth 25. Peeing on a jellyfish sting. Thanks to the TV show Friends, everyone thinks urine cures a jellyfish sting. In reality, urine is just urine, and it can make things worse. The reality. Urine varies in acidity. If your pee is too dilute, it acts like fresh water. Fresh water triggers the nematocysts, stinging cells, that haven't fired yet to explode, releasing more venom. You are just standing there with a burning leg, smelling like a toilet. The correct treatment is vinegar to neutralize the cells, or hot water to break down the protein in the toxin. Keep your pants zipped. Myth 26. Rubbing snow on frostbite. It seems logical. It's cold, so use cold to warm it up slowly? Or maybe scrub it to get blood flowing. This is horrific advice. The reality. Frostbitten skin is filled with ice crystals. It is fragile and dying. Rubbing it with snow is like taking sandpaper to a burn victim. You are shredding the tissue and introducing dirt into open sores. Friction creates heat, but it also destroys the capillary beds you need to save the fingers. You need warm, not hot, water or body heat. Never rub. Treat it like delicate glass. Myth 27. Alcohol for warmth. The image of the St. Bernard dog with a barrel of brandy is a myth. Alcohol is a vasodilator. It opens your blood vessels near the skin. The reality. This makes you feel warm because hot blood rushes to your surface. But that means the blood is leaving your core organs, heart, lungs, brain. You are radiating your body heat into the cold air at an accelerated rate. You will get hypothermia much faster if you are drunk. If you are freezing, drink sugar water or hot cocoa, not whiskey. The beer jacket is a death shroud. Myth 28. Shaking a drowning victim. In old movies, they pull a guy out of the lake and roll him over a barrel or shake him to get the water out. The reality. Drowning victims don't usually have lungs full of water. A spasm in the throat often seals the airway, dry drowning, or the water is absorbed into the blood. Shaking them just wastes time and risks vomiting. Vomit in the lungs is harder to treat than water. They need oxygen. They need chest compressions to circulate blood to the brain. Forget the water. Fix the pump. Myth 29. Spoon in the mouth for seizures. This is a persistent myth that hurts people every day. If someone has a seizure, do not force a spoon, wallet, or your fingers into their mouth. The reality. It is physically impossible to swallow your tongue. The tongue is anchored to the bottom of the mouth. However, the jaw muscles clamp shut with incredible force during a seizure, enough to bite through wood. If you stick a spoon in there, you will snap their teeth off, which they can then choke on. Or they will bite your finger off. Just turn them on their side to keep the airway clear and wait it out. Myth 30. Breathing in a paper bag. You see someone hyperventilating. You hand them a paper bag. This works for a panic attack, but it's a massive gamble with their life. The reality. If the person is hyperventilating because of an asthma attack or a heart attack, which looks similar to panic, they are already low on oxygen. By making them rebreathe their own carbon dioxide from a bag, you are suffocating them. You are depriving a dying heart of oxygen. Unless you are 100% sure it's just anxiety, never restrict their air. Oxygen is always good. CO2 is not. Conclusion. And there you have it. 30 ways you were planning to kill yourself, successfully debunked. You are a soft, fragile bag of water walking through a world of sharp edges. The least you can do is stop taking medical advice from cartoons. Survival isn't about being a hero. It's about not making the situation worse. The rules of first aid change because science learns from our mistakes. Don't be the guy who relies on 30-year-old myths. Take a real CPR class, buy a real tourniquet, and for the love of God, stop putting butter on your burns. Stay safe. We'll be watching.